Good afternoon, everyone. I hope we're all doing well. It's 21 minutes past 3 p.m. Very sorry for being late, by the way, because we're supposed to start at 3, but we're here anyway. So, my name is Dr. Nansubuga Angelisa, and I am a guest speaker today. I'm here as a member of the Rare Mark Foundation, but also clearly content expert as per today. Yeah, so I want to take us through a session on pregnancy in sickle cell disease, because as a warrior and also a doctor, I've gotten like a gazillion warriors coming up to me saying they're scared of pregnancy, they don't know how to navigate it. Like, life is already hard, like without the pregnancy bit. So they're all thinking, is this like something I should really do? Yeah, so I'm here to answer a couple of questions you might have. So the comment section is open for you to, put all your questions. I will answer them slowly, yeah, as I see them, hopefully. And if this session is not enough, well, we can always think about another one because there's a lot to say, trust me. Yes. So let's get right into it. So the first question I'd like to answer is, what is preconception care in sickle cell disease and what's its importance? So basically, preconception care is care given to a sickle cell disease warrior before they get pregnant. I know in the world we live in right now, very few pregnancies are planned. Like, you're just there and it has found you. But in sickle cell disease, because, there's a lot of mindfulness we need to do with our health and things that may impact our bodies physically, emotionally, we need to be prepared. So preconception care is basically done 3 months before conception. Say you want to conceive in March, then you have to start your preconception care in December, actually, because we want 3 months prior. So the whole December, the whole January, and the whole February. So that March you can now conceive. That's the time that you start preparing. So the things that we do in preconception care are quite a number. The first one could be genetic testing of you and your partner, because ideally, before you think of having a child with this partner, you should have already done this testing, like to check their genotype to see if they have the sickle cell trait. That should be before you even get in the thick of the dating things, like, because trust me, when love catches, it's hard to rewind. But still, in the preconception counseling, we still do that genotype testing. And then we are able to also retract some medications. For example, hydroxyurea. Hydroxyurea is a drug used to treat sickle cell disease. It has shown very good results, and many of the warriors are on it and thriving. However, it has also other uses, like it's an anti-cancer drug. And in that way, it's a cytotoxic drug, like it kills multiplying cells, And remember, a baby is a multiplying group of cells. So it's kind of like risky. They have not really shown data that concretely shows that it's going to kill the baby, but there's a risk that it could do that. So we want to stop hydroxyurea 3 months prior to conception, so that by the time you conceive, all the hydroxyurea in your system has been cleared out. Then we want to start you on supplements like folic acid. Well, folic acid is also routine care for sickle cell disease. So basically, we take you off the hydroxyurea and just leave you on folic acid and monitor how you thrive through those 3 months. There are also a couple of tests you need to do, like, of course, the CBC. We need to check your blood levels, like baseline blood levels before you conceive and you've been taken off the drugs. How are you coping? How are your livers? How are your kidneys? Everything needs to be checked so that they know where we're starting from, like what's the starting point of this particular human body before we put another human being inside it. Because we know pregnancy has its effects on women, even those without sickle cell disease. So now imagine you already have sickle cell disease, which also is very heavy on the body. Now that's why we want to like check, what can we do to help you thrive? And also, it may be sad, but sometimes as warriors, some of our bodies may not be compatible with actually carrying a pregnancy. Yeah. I will not say I can pinpoint it right now, but that's what preconception care is for. When you go and see a doctor, they can be like, maybe you're already undergoing some level of kidney damage, some level of liver failure. And so you like, it may not be really advisable for you to carry a baby in your own womb. But there are so many ways to have a child. I mean, people adopt children. You can also do in vitro fertilization. That's where like they just use your ova and then your partner's sperm and like create your child outside your body, and then use like a surrogate mom to have the child. So you'd be part of that process, just not directly. And that's only if your body can't handle it. Yeah. So we can only know this during the preconception care. Yeah. This is a time that is needed for us to kind of get prepared, because I know so many warriors are scared of getting pregnant because they're scared of what it could lead to. Yeah. And if you actually give yourself time to prepare for it, my opinion is that by the time the pregnancy starts and you had these 3 months prior, your heart would now be like settled, yeah? And you're not like panicky over the unknown and everything, because you have like a concrete, solid plan. Yeah, so that's it for preconception care. So the next thing is, what should I do if my partner also has a sickle cell trait or disease? This is a tough question, but I think I hinted on it before. Just try and make sure if you're interested in someone, before you like catch like real get deep feelings for this person, as long as you think they're special enough for you to want to pursue a life with them, try to be open with them about your sickle cell status first of all, and then try to get them tested. Because the actual answer, my honest opinion to that question of what do you do if your partner has a sickle cell trait, my honest opinion, guys, don't come for me. My opinion is to leave them. Yeah, I'm so sorry, but I do not like, I've treated a lot of sickle cell patients, a lot of kids in pain. I mean, I've been through that pain myself, and it's not nice. It's not nice at all. Yeah. So I would not want anyone else to have to get sickle cell disease if their parents could have prevented it. Yeah. So that's why the first advice I gave is, before you like get attached to this person irreversibly, yeah, try to get them tested by then, so that you have time to make this decision when you still have sound mind. Because love is blind. When you fall in love, you may not be able to make that decision. However, even for those that have fallen in love and can't go backwards, there are the options of in vitro fertilization. You can do genetic testing, like they make a couple of embryos and try to make sure they pick that specific one. Because if your partner carries the trait, just the trait, i.e. they have AS, it means that they have a normal part, which is the A. So you can just do that genetic testing on all the different embryos and try to make sure that the one you pick has, of course, S from you, because you are a warrior and you only have SS, and then an A from your partner. It's a bit costly, but yeah, if you are in position to afford it, then that's an option. That's an option. But yeah, I do not recommend a warrior to be with someone who has the trait or a fellow warrior, because it will just recreate the turmoil you have lived through your whole life. And I don't think it will be easy to see your children suffer the same thing. I honestly do not think so. Well, what else? Let me see. Are there any questions for me to answer? Guys, someone is asking, what are the consequences of conceiving while I'm still on hydroxyurea on the baby and on the mother? So as I said previously, there is no like proper, data out there to prove, that like hydroxyurea is going to kill the baby. Yeah, it's not there. But the reason that it's stopped, it's like a precaution. But I believe that as research in sickle cell disease is progressing, they'll probably find out if it has any like significant effects. But of course, in research there's this principle we go by that says do no harm. So you can't exactly like intentionally make people get pregnant when they're on hydroxyurea when it's risky, you get. So if you're to do such a study, you have to just be lucky and get those few participants who have accidentally gotten pregnant when they're still on the drug and maybe just follow them up. But like, you can't also just make them stay on the drug when they've already found out they're pregnant. Like, it's not right medically, so you can't exactly carry out the research. That's the problem. It can't directly be carried out. So for now, I have seen a couple of warriors who have actually, because as I said at the beginning of this show, in our society here, it's so hard for someone to get pregnant because, I have planned and I have intended, this is my time, I'm getting pregnant. No, it rarely happens. So most times you're going to find the person is totally on their own things, they're taking their hydroxyurea and then they're pregnant. But actually most of them thrive. We never really found a case of a child who has maybe passed on or what. But in sickle cell generally, and pregnancy, there are some complications that can occur. And now, if you're also on hydroxyurea, it's hard to separate, to say that the consequence was from the hydroxyurea or it was just from my body and the disease and the baby, like that whole combination. So it's not advised. So once you conceive while you're on it, you just have to stop the drug and then we go from there. But the babies actually thrive in most of the cases. Yeah. And actually, there are some patients who like depend a lot on hydroxyurea. Like they don't have, their health status is not so good. Their quality of life is not so good. So taking away the hydroxyurea might be more of like a risk. Like we do this benefit versus risk. So you may take them off the hydroxyurea and like it's worse for the mom. And even in obstetrics and gynecology, the mom comes first. You're not going to save a baby and risk the mother's life. So if you see that this mother really depends on the hydroxyurea, the obstetrician who is like specializing in handling high-risk mothers like those with sickle cell disease will have to weigh and make the choice to either stop the hydroxyurea totally or stop it for only the first trimester when the baby is mainly being formed and then start it again in the second trimester, or totally still stay on it. Like it's a lot, but it's about getting into care in time. Like even though you've not done preconception counseling and you just find out you're pregnant, just get into care with an obstetrician who is qualified to monitor your pregnancy and everything will be fine. Let me just check for any other questions. Okay, I think that's the question that I've seen. Are all warriors in danger of facing a high-risk pregnancy? Unfortunately, yes. Unfortunately, yes. But like, when they say high-risk pregnancy, it does not necessarily mean that, your pregnancy is going to be bad. Like, in medicine, we have this saying that goes, diseases do not read books, okay? So even though in the textbook you read in medical school, it says that if someone has sickle cell disease, they are at risk to get A, B, C, D, E, F, G when they are pregnant, our bodies react differently. For example, if I have flu, okay, apart from of recent, I have never gotten like that flu where I'm like, oh my God, I can't breathe, I can't go to work, I'm so weak. But I have friends who don't even have sickle cell disease who react that way to flu. So do you get my point? Like, My point is that our bodies react differently. So despite the fact that a pregnancy in sickle cell is termed as a high-risk pregnancy, it's just a way to put it as a priority, like to prioritize this person and carefully monitor them. But it doesn't necessarily mean that they are going to have a terrible pregnancy and, everything bad is going to happen. No, that's not what it means. It just means that we need to look out for you, monitor you every step of the way, and be very cautious about everything to prevent their consequences. So back to my questions. Someone asked if folic acid is really important and how much should they take. Folic acid, yes, is important. One thing is that folic acid in sickle cell disease, what it helps with is that it helps in production of hemoglobin, yeah? And remember, you need hemoglobin in your blood cells to transport oxygen and etc. I don't want to get so medical. But in pregnancy, the normal changes in pregnancy will lower a woman's hemoglobin levels. But now remember, in sickle cell disease, your hemoglobin is already tanking. So you need something to help you keep it up. And now you don't have hydroxyurea. And so folic acid is the only thing that you can use, because as other women use both folic acid and iron supplements, in sickle cell disease, it's not recommended to use iron supplements because we already have iron overload. The reason warriors have iron overload in their bodies is because when their red blood cells that are sickle in shape are broken down by the body every time they sickle, the byproduct, one of the byproducts is iron, because iron is used to form those cells, yeah? So now that iron that is remaining in your body when those cells are broken down, it doesn't go anywhere. It stays in your body and is just slowly taken out of the body, but very slowly. So in that, you always have more iron than you need as a warrior in your body. It's just very, very, in fact, so rare to find a warrior that actually needs iron replacement because of that phenomenon. So in that way, we don't give warriors iron supplementation because there are actual consequences of iron overload. The one they have is already too much, so we don't want to add more to it. So this is why folic acid is very important in pregnancy, because it's literally the only thing we are giving you. That's it. Yeah, and maybe occasional blood transfusions if you are in crisis, or maybe your doctor thinks your HB has gone too low. Yeah. Okay. Oops. So the next thing is to ask about how do I deal with fear or anxiety about pregnancy complications? It's just a tough one. It's a tough one because this is you've lived with this fear and anxiety all your life already with just having sickle cell disease. So I can't say that it's going to be easy. But what I can say is that you just need support systems, because that fear and that anxiety is going to be there. It's already there when you don't have a baby inside you, when you're not carrying two lives. So when you start to carry two lives, it's definitely just going to multiply. But what is recommended is trying to always keep a good support system. Yeah. Our Warriors Group Mama, Solo, shout outs to you, Solo, just told us, shared her story recently. You guys should check it out on our pages. She said that when she was going through her pregnancy, it was really tough. She had so many questions. At some point, the disease was not even the problem. My assessment was she was the problem, because she was so negative about so many things because of the constant thoughts of, oh my God, this may happen, oh my God, this may happen, oh my God, this may happen. But in the end of it all, she realized that allowing help and accepting that, yes, I have this, and that's not going to go away. And then working on what you can actually change, yeah? the whole anxiety and fear thing comes from us thinking of the worst case scenarios happening, and yet we are not in control of that. But what are you in control of? Hydrate. Take your folic acid. Eat well so that your baby can get good nutrients from what you are eating. Yeah? Keep yourself stress-free so that you don't trigger yourself into crisis. Yeah? Socialize. Avoid those thoughts, because sometimes stress is not like physical, but it's also emotional, and it can still culminate into a crisis for you. So try to like socialize. If you feel like something is bothering you, talk to someone about it. Like, don't let those thoughts build up in your mind. Like, if you feel like, oh my God, what if X, Y, Z happens, and you're so confused about it, talk to your doctor, for example, because they may have an answer that will, be the right one to calm you down. Talk to your mom, talk to your friends, talk to your partner. There are lots of people you can talk to try and allay that fear and anxiety. Yeah. What lifestyle changes should I make before trying to conceive? Lifestyle changes. Stop smoking and taking alcohol. People with sickle cell disease like to. Okay, it's a thing that I admit to also do, because I have been through a lot of pain. When I'm fine, I like to have a good time, like the bestest time. And sometimes it involves doing things that may be strenuous to my body. It may involve taking alcohol. I personally do not smoke. That's so dangerous. Guys, don't smoke. Also, don't take alcohol. But yes, do not do that. Like, if you're planning to get pregnant, smoking can damage your lungs significantly. Already, when a lady gets pregnant, the pregnancy is like pressing onto their lungs and their chest cavity. So it's reducing the space in there for air to fill up when you're breathing. But imagine you're there busy smoking all the time and your lungs are already even half burnt. Now you also want to have a baby who is like, it's just going to be dangerous. So just stay away from smoking. Don't take alcohol, because please, even in a normal person who does not have sickle cell disease, alcohol is not good in pregnancy. It causes alcohol fetal syndrome. And that will make your baby not a normal child, and you will not like that for your child. So those are lifestyle changes I could say. Also, eating healthy. Yes. When you're pregnant, you have to purpose to eat healthy, like with everything you have in you. Like, stay away from your laissez-faire lifestyle of I go to work, then I come back and eat commando from that roadside store, and then I take soda, and then I sleep. Then in the morning, I'm so late for work. Woo! I'm running, I'm ready on the road. I've not eaten anything. Like, that's not good, because now you're eating for two, and you need serious, good nutrients for the baby that you're carrying. So you need to be intentional about eating healthy. Yes. And hydrating, of course. Of course, hydrating. Let me even show you guys my nice bottle. You see my nice bottle? Oh, I also have a bakery. I'm the CEO of Lisa Confectionery. So yeah, this is my nice bottle. I have another one that says Dr. Angelisa. It carries about 1.2 liters. We have to be drinking, like, all the time. Drink your water. Drink your water and be intentional about it. Like, it's not a thing of only when you are trying to prevent getting a crisis, but now even the baby needs the water. And actually, in pregnancy, women tend to pee a lot because the uterus is big and it's pressing on the bladder. So every time you're peeing. So it's like you're losing a lot of water. The one you're giving the baby and the one that you're peeing out. So you need to like replenish. So please be intentional about drinking your water. Next question. Why is it important to have a care plan before I get pregnant? Guys, this question is basically like already what I've been talking about. I have already answered that question. You need to have a care plan because there's so many things that you need to be evaluated for. You see, like your body needs to be I don't want to say at 100, but if possible, your body needs to be at 100 for you to be able to carry a child. So that's why you need the preconception care. You need to know that your partner is right, i.e. they do not carry the sickle cell trait. You need to know that your body is right. You need to know that your organs are right. You need to know that your health, your mental health, you are emotionally ready for this. Okay. So that's why it's very important to have a care plan before you get pregnant as a warrior. But I still say, in our society, even though it just happens and it has come, please don't go and abort your child, because children are a gift from God. Do not commit murder because you are scared of what it's going to do to you. And it's even not legal in our country, so be warned. Yeah. But anyway, I know people can be pushed to the wall to do such things because they are scared. However, my advice is that, yes, like, a child is a gift from God. And it's true that many warriors have not been able to be mothers because maybe they haven't been having like good care from when they were children. So by the time they are old enough to have children, so many complications of sickle cell have hit them left, right, center, that their bodies are not fit to carry a child. But like, the mere fact that you have been able to conceive this child is awesome, and it's a gift from God. So instead of fearing it, you should just embrace it and just get help to handle the situation. Yeah. Do things like, if you could get insurance cover, please, by all means, because guys, sickle cell disease is like very financially draining. Like, leave pregnancy alone. Like, it's like you're in hospital almost all the time, unless you're doing something right and you're no longer getting sick. But it already has so many chances of you getting to the hospital. So if you can get a way to reduce the financial burden, because for example, imagine you get pregnant and like, God forbid, you start getting some complications of pregnancy like preeclampsia that are actual risk factors in sickle cell and pregnancy. If you get them, you're probably going to need to see your doctor more often than any other person needs to see their doctor. Yeah, you're probably going to spend more money on medication. You're probably going to have to stop working, so at least have an insurance cover so that you can always get like health care, even though you can't like pay for it out of pocket. Basically, the plan helps you to try to get ready for the unknown, and the unknown is crazy. It's a lot, but planning, I'm a person who plans a lot, so I believe planning really prevents a lot of like shock. Okay, because sometimes something can happen and you're just in shock, like, how do I move from here? But if you had a plan, you're probably going to have a part of that plan that could have covered that problem. And even though it's not there, you won't panic a lot like someone who didn't have a plan at all. Yeah. How often should I see my doctor when I'm trying to conceive? Well, it depends on what your doctor says. It could be every month of the 3 months. It could be every 2 weeks. Like, basically, it's not set in stone. This is decided by you as an individual. You have your own way your body is responding to the disease. So you have your own like complications that you're suffering. It's not everyone's like it's not like everyone is suffering the same complications. So like, I may have to see my doctor like 3 months, and then another person may have to see their doctor like every week. Another one may have to see a doctor like, I don't know, once in 2 months because they are so healthy. I don't know. Okay, once in 2 months is dangerous, but if you're trying to conceive, once in 2 months is not so bad. You're not really sick, like you're just trying to conceive. It's during pregnancy where like every month is crucial. You need to see your doctor every single month or more without fail to avoid like anything catching you off guard. Yeah, we need to be prepared. So I think that kind of tries to sum it up, like sickle cell in pregnancy. And there are actually guidelines by WHO on sickle cell disease in pregnancy. I don't know, maybe you could Google them. I have a copy, so if you could reach out to me, I could share it with you. But basically, these guidelines, of course, they are mostly made for healthcare workers, and I'm a healthcare worker. That's why I have them. But even you as a warrior, maybe if you stumble upon them and read, you could know what is entailed in pregnancy during sickle cell disease, what you need to do. Because like there's some remedies, like let's say aspirin, that sometimes need to be taken care of. That need to be taken by you, because aspirin is a drug that prevents blood clotting, yeah, and pregnancy is already a state that can cause your blood to start clotting unprovoked. So in sickle cell disease, it's worse, because also sickle cell disease can cause your blood to do the same thing. So we may have to take aspirin during your pregnancy to avoid that clotting. Aspirin has also been found to be important in preventing preeclampsia, which is hypertension, high blood pressure in pregnancy. Yeah, but like patients with sickle cell disease have a high risk of getting that high blood pressure in pregnancy, because we already have our small tiny vessels now. Like there's a whole lot of stuff that go on in your body that make it more risky for you. So these guidelines have pretty much a lot that's in them. They are loaded. They're loaded. So okay, it may not be easy for a layman to understand them, but you could get a few things or two. And you know, when you read them, you get inquisitive. You'll be like, now they have said aspirin. Now they have said I have to push because it's safer for me to push. Why is it safer for me to push instead of getting a cesarean section? Because I don't want to go through the pain of labor. Like it gets you inquisitive, so you actually can reach out to your doctors more and ask them for help. And trust me, they will respond, because the best patient is the patient who actually is interested in their health and asks questions. Because the truth is that as doctors, we see so many patients, like sometimes something may not be like at the forefront of your mind, but if your patient is inquisitive enough about their situation and knowledgeable enough, it has its own disadvantages, but it actually helps you to be more like involved, to put all the things that matter on the table and work on them as a patient-doctor relationship. So that's basically it. For anyone who wants the copy of the guidelines, just reach out to us. We shall try to get them to you. And finally, my word of encouragement to all the warriors out there is that all this has been said. I have said everything that I have said here. But remember that you have a God. I personally believe that sickle cell is such a tough journey. It's such a tough journey, and I do not think that without God, there is navigating this journey. Like I think without God, it's not possible to navigate this journey. So even when you see that, okay, now it's time to get pregnant and I'm so anxious, or I'm already pregnant, like apart from everything I've said, remember that God loves you. And remember that you can ask him, because he gives freely to his children that ask him. Remember that he's not a man to lie. Remember that he has not brought you this far to let you down. Yeah? Trust in his word when he says that he can be your refuge in your times of trouble. And ask him intentionally for everything you want. If you want him to protect you from getting sick, tell him every day. If you want him to protect your child and keep them healthy, and because you have anxiety about maybe getting a miscarriage, tell him, do your part, and tell him, you know what, God, me, I've done my part. Now it's your part. This is the, in relays, in sports, you like pass the baton and be like, I've done what I can. The doctor has done what they can. Now the rest is in your hands, because you really hold us like in your hands, and God has the answers to everything. That's what I believe. If you're ever in doubt, just pray and ask him to guide you. Yeah. So that's it. I don't know if you guys have any other questions. Anange. I'm so poor at lives. I've not been checking, but yeah, I don't think there are many questions. Okay. In your medical opinion, do you advise for a warrior to deliver naturally or by C-section? Naturally is the way to go. Yes, naturally is the way to go, because C-section is a surgery and surgeries have risks. You know, if you've watched any of those medical series, though you'll see how the doctors before any surgery read out a whole list of this and this and this and this before surgery to tell you that these are the risks, and you're going for this surgery knowing them. Whatever happens, you've consented. So it's the same thing here. C-section is a surgery. So it's more risky than normal delivery in sickle cell disease. The only loophole is that, of course, normal delivery is painful. We all know it. But there are options. For example, there's an epidural anesthesia. It's like a painkiller that's given via the spinal cord to like reduce the amount of pain you feel throughout labor. Yeah. It might prolong labor a bit more, but still, at least the pain is not so grievous. So you're more able to withstand it. And also, after normal delivery, the body returns to normal faster than after C-section. C-section, you have a lot to deal with. There's even the chance of the scar getting infected. Of course, you know, in sickle cell disease, you get an infection, you're in a downward spiral to a crisis. So basically, we recommend normal delivery as opposed to C-section. However, of course, C-section can still be done where need be, yeah? And this is all discussed with your obstetrician when you get pregnant. There's someone who's asking, are warriors allowed to gym? I think so, but everything in moderation, because you know that gymming is going to strain your body, and so you're going to use up a lot of oxygen as you do the gymming. And now when you use up a lot of oxygen, it's going to cause stress in your bloodstream, and this is a risk factor for your cells to sickle. And when they sickle, we know the end of the story. So if you're going to gym, you have to be very good at hydrating, eating well, and doing it at a limited rate. Don't overdo it. Don't think you are these bodybuilders. You need to give yourself to be considerate of your body. You know that our bodies are different, and you know your body. So if you know your body can take 15 minutes, do that. If you know all you can do is walking yoga like me, please, by all means, walk. If you know you can lift weights for 5 minutes and then just use a treadmill, do that, because it's still getting in some good exercise for you. Because of course, we don't want to tell you, no, don't do any exercise, and you just be there like a vegetable, planning to get non-communicable diseases like hypertension that are just going to complicate your life more. We don't want that. So we want you to try to keep active. Yeah. Let's see if I have another question. Yes, Salome is saying you have to know which medication you're taking if it's not dangerous to the baby. Yes, that brings me to a point of pain management. It's because all this is you're sometimes going to get crisis when you're pregnant. But now, you know, all these painkillers we take, the more the pain increases, you're like, let's move from Panadol. Now we're on Dynapart, and now we are on Celecoxib, and now we are on Pethid. In pregnancy, you're not thinking about only yourself and your pain. Some of those medicines travel through your bloodstream and go to the baby and can damage your baby's brain. So there's no taking painkillers anyhow. You only take the painkillers that your doctor has recommended, which is Panadol, by the way. Panadol is the most recommended one. Morphine is allowed, and also sometimes NSAIDs like Dynapar and ibuprofen, but there are different trimesters of pregnancy where different pain medications are not allowed and should be limited. So that is why if you get sick as a warrior and you're pregnant, please, this is a home self-medication. They are over. We first leave them after the 9 months, because now you're going to get into serious pain and you need help to monitor it. A doctor could be able to administer morphine at the hospital, but they know at what level they need to stop giving you morphine. Yeah, but for you at home, you may not know, and it may be dangerous to your baby. Okay. Another question. Okay. Someone is saying they use NHS guidelines, yeah, and compare it to WHO to know, what they need to take. And yeah, Solo also says she found talking to God helped her. As I said, it's very helpful because sometimes there are some problems that really occur and you're just like, you're put in a place of total surrender, like me today, God, my hands are up because I can't, like on my own, I cannot even, like you're the only one who can help me to navigate this, and he will actually help you. You'll find that he'll give you the peace you need and the grace you need to sail through that situation. I think I'm done with answering all the questions. So yeah, I want to say thank you so much for attending this live. Thank you for supporting Mac Foundation. Please talk about sickle cell disease everywhere you go. Spread awareness because we want to end sickle cell disease. Like, it may seem like sickle cell disease is the reason we're here, but we're here because we want to end it, because it's not good. So please tell a friend about sickle cell disease. Know your genotype. And also, please follow all our pages. There is this one Instagram page. Follow our TikTok page, our YouTube channel. Oh yes. For all those watching on YouTube, hello. I know I was focusing on the live, but yes, there's also, this video is going to be posted on YouTube for those who are not able to attend the live and need to listen to this information. So you can always look for our YouTube channel, like, subscribe, all those things. What else do they say? Follow, like, subscribe. Please do that for all our social media pages. And yes, stay blessed. Thank you for watching.